Well, yes. I mean, it's interesting that as we've developed these more modern medicines, the medication cost has gone up much more than your standard pill medication. However, the cost of care in the United States particularly has been exploding. And in the US, your insurers don't just pay for the cost of the medicine, but they pay for the overall cost of care. And some insurers are actually employers too. And if you can show that a medication may cost more per dose, let's say, but ends up decreasing hospitalizations, surgeries, emergency room visits, you actually may save money or at least be cost neutral. Another angle is also looking at what are called indirect costs. So indirect costs are the costs of early retirement or going on disability, not working at full capacity at work, not quote-unquote working at full capacity at school, impacts on other caregivers in the family, whether they be spouses or others who might need to, i.e. bring you to the appointments, go to the hospital with you, or even alter their plans and lifestyle based upon illness. So the costs associated with illnesses go far beyond medications, and any conversation, particularly in the United States, about costs have to include not just the medication cost, but also the cost of care. Well, the point is that I see the topics on the agenda, what's going to be presented, but it's always exciting to see what's going to be revealed and told. And in combination with this meeting has just been deadlines for submission of research abstracts to the American Gastroenterological Association and to a European meeting also too. So there's a lot of research that we may get little hints at, the real cutting edge stuff that may get little hints at this meeting, as well as some updates from earlier meetings this year where, let's say, perhaps we had earlier updates, but now we're getting the full story about that too. So I'm looking forward to not just what's in the print, but what's going to be revealed between the lines. No, I just think that it's fantastic that the MD magazine is doing this. It's very, very important, not just for the people who are here at the meeting, but also the people who didn't have the opportunity to come, to understand that there's an active body of not just the clinical people and the research people, but even industry that are striving towards understanding not just inflammatory bowel disease, but human diseases and how to best treat them.